Good evening, everyone. My name is Jonathan Landsman. I'm our board chair. I welcome you all to our April general board meeting. So this is our call to order. First item on the agenda is the Pledge of Allegiance. We'll stand and I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next on the agenda would be the roll call.
Mr. Young.
Here.
Mr. Furman.
Present.
Mr. Cowan.
Present.
Mr. Torres.
Present.
Dr. Hans. She's present. She stepped out for a second. Ms. Newman. Here. Ms. Root. Here. Ms. May. Here. Ms. Woodward.
Present.
Dr. Giles. I did not receive any communication from her, just so you know. And then Mr. Landsman.
Here. Thank you. So we have a quorum. Next up, I need a motion to approve tonight's board agenda.
So moved.
Thank you, John. Is there a second? Thank you, Sarah. So a motion, a second. Is there any discussion? Hearing none, all those in favor say aye.
Aye.
Any opposed? Motion carries. God bless you. Next up on our agenda would be public comment. And I see you, Fred. Is there anyone remote that has expressed an interest in public comment?
No comment on that.
Okay, thank you. Okay, locally we have Fred Cummins. If there's anyone else who would also like to make comment, we have a sign-in sheet. Fred, please come on up. Mr. Cummings, sorry.
Working?
Yes.
Fred Cummins, President of the Alliance for Mentally Ill of Oakland County. I have a concern, I guess a question. I understand that there are a number of people who are on Medicaid today and at some point in the near future will not be. And I'm concerned with their departure. I assume that there's some number of them who are receiving services from community mental health. That where do they go from here? What happens to the services they're receiving? What happens to the medications they're receiving? And is there some kind of a graceful departure? I would hope that they would transition to Healthy Michigan. But I don't know what that transition might be, whether that means that they apply for something that they suffer going through a period of no services, no medications or whatever, some period of time before they qualify for that. If they qualify for that, I'm not sure that there's a smooth link between Medicaid and Healthy Michigan. Beyond that, those same people and probably many more are served by Medicaid HMOs. And the departure from those services might not be as traumatic for as many people, but could be for some. And again, I don't know if they can transition simply to Healthy Michigan and whether there's a gap or whatever. But I think that's very serious. I think some people could have some serious conditions which cannot just be dropped and expect them to get through that. So my concern certainly is for people who are in Oakland County served by CMH, but also for people under Medicaid HMOs, and for that matter, people across the street. Because I was at the Board Association meeting in the spring. I had heard that this was happening, but I heard nothing about how it was going to be a somehow managed transition. So I'm concerned about that, and if you've got a plan, I'd like to know it. But I think that we ought to make sure that there's a plan at the state level for people across the state, because they shouldn't be just dropped. And there's a high risk because these people, many of them their Medicaid was extended for some period of time for COVID, and it's about to come to an abrupt end. So it would be good to know that that's being managed. And even if it really does drop abruptly, I hope there's some way of helping them through a transition, maybe some additional funding or something, so that their care does not just stop. Thank you very much.
Thank you for your comments. As people know, we have 5 minutes per speaker. If there's anyone else that would like to have public comment, we have another opportunity later on during this meeting. Thank you. Next up on our agenda is my favorite, which is Stories That Inspire. Tonight it's with the folks from Disability Network Eastern Michigan. Welcome.
Good evening, everyone. I would just like to introduce our Stories That Inspire Hope. I'd like to introduce Carrie Gerdeman. She is from Disability Network of Eastern Michigan, and I am happy to announce she was our keynote speaker for the Abilities Awareness event back in March. And it was such a great opportunity for us to learn all the great things that they do at Disability Network. And I'm just going to do a little quick introduction of Carrie, just so you know a little bit more about her. And then she is going to cover all of the different activities and options that are available through Disability Network, and even a little bit about some of the partnership with Oakland County Parks. So Carrie is the Recreation and Health Services Director at Disability Network, DNEM. Is that how we? DNEM, thank you. This is a Center for Independent Living in Oakland, Macomb, and in 5 other counties in the Thumb area. So her time she has implemented numerous inclusive and adaptive recreation programs for people with disabilities. You're going to see some of that, some pictures of some of those activities that she's developed. But those include adaptive kayaking, art, golf, gaming, yoga, therapeutic drumming, and Divers Ability Outdoor Recreation Day. She's very passionate about community collaboration and adaptive recreation. She actually was very kind to hand off something that she was doing this evening so that she can be here tonight to speak to us. So I'm going to go ahead and hand it over to Carrie.
Thank you. Thank you for having me. Until you said that, I forgot that I had another program at 6. I hope my staff is running it. I forgot to remind them, but you can. Thank you. So I work for Disability Network Eastern Michigan. You can go to the next slide. Thank you. This is our team. As Suzanne said, we service 7 counties, Oakland, Macomb, and then the 5 counties of the Thumb. We used to be known as Disability Network Oakland, Macomb, and we took over the Thumb Center for Independent Living a year ago, and so now we have that region as well. This is our department, and in the back you can see our large trailer that we fill with adaptive recreation equipment and take all around the counties. Next slide, please. You can go to the next slide. Who do we serve? We are a Center for Independent Living, which means we are run for people with disabilities, by people with disabilities. So 50% of our staff and 50% of our board have a disability. We service people of any age with any disability in our 7 counties if they live or work in those. Our purpose is independent living philosophy to help them to achieve as much independence as possible. So my job is to do that through recreational therapy. We have 5 core services: advocacy, which is mostly self-advocacy, helping people, giving them the tools to advocate for themselves; information and referral, which is a team of people that answer the phones, or we have website chats where we give information on everything from housing to accessible activities in the community, support groups. And then we refer people to services that they may or may not know of. And independent living skills training, we have a little apartment, so we do independent living skills assessments, and then the recreational therapy, adaptive recreation falls under IL skills as well. We have peer support because 50%, actually 77% of our staff have a disability. We run disability related peer support groups, but also do it one-on-one. And we help transition people from living at home to living independently, whether that be young people or whether that be people living in a nursing facility, and then we help transition them out into independent living. So, you can keep going on this one. I'm going to go fairly quickly. I just want to get to the recreation stuff. Here we go. So this is a picture of us doing adaptive kayaking. We partnered with Henry Ford Hospital last summer to provide some individual services to their stroke support group. And we have a new grant this year. So we have 11 kayaks, including a tandem, which means someone who maybe does not have the ability to paddle independently can still participate because we will put them in a double kayak. We just obtained $36,000 additional dollars in grant funding to buy more adaptive equipment. So since I did the presentation last month, we have new programs coming out. I'm going to the west side of the state soon to learn adaptive water skiing, and so I can bring that over to the Thumb area next summer. Next slide, please. So our RECIT program, which is what we call Recreation, Education, and Community Inclusion Team, we provide education, so we do a lot of assistive technology demonstrations, skill attainment. I do individual assessments to help people come up with a plan for independence and recreation in their leisure life. And then we provide opportunities to participate, whether that be with us or out into their community in a community-based adaptive recreation program. So we personally have adaptive crafts, kayaking. We partner with Michigan Adaptive Sports to do downhill skiing. We have adaptive yoga instructor, cooking classes. Diverse ability days are, we have one in Oakland County, one in Macomb County, and actually we're doing one at Kensington, which is half Oakland, half Livingston. So we're expanding that, and that is where people can come and try the kayaking, accessible pontoon boat rides. We have adaptive golf, adaptive archery, hand cycles, e-bikes. We partner with a bunch of community agencies to bring a lot of those pieces with us so we can have one big day where everyone can participate. We have a couple hundred people came last year. It was our first year. I do adaptive inclusive art classes, and then this year will be adaptive golf. This is just pictures of our art class, and we provide those at our Troy office, but also in the community. I just received, I'm going to be going back to Ruth Peterson Senior Center in Pontiac. I went last year and taught some art classes, and I'm going to go back to that again this year. This is a picture of the golf. So we partner with Oakland County Parks for a lot of our programming. This is the Diverse Ability Day at Independence Oaks, and you can see that they have archery instruction, and we provide the adaptive technology. We're really fortunate in Oakland County because we are one of the only counties in the state that has a recreational therapist on staff in the county, and we'll talk a little bit about that with, next slide, please. So this is the partnership that we have with Oakland County Park. So we provide inclusive programming together. We provide inclusion training for all of the Oakland County Park summer staff. Adaptive equipment we share. So she has, Go Ball, which is for people who are blind or low vision, and then we have the kayaks, and there are a lot of other pieces that we share. The Oakland County Parks has adaptive dances, many socials, and then we have the Dreams and Wings, which you probably have heard of. That is where children with disabilities get to go up in an airplane. Disability Dirt Day is at Holly ORV Park, and that is specifically, there's a ton of volunteers that come, and we have anyone with physical or any disabilities to come and ride in side-by-sides or, I don't know, all these other things, what they're called, dirt things. Thank you, ORVs, because it's Holly ORV Park. So, yeah, and we partner with U of M, and they bring PT students to help transfer people into those vehicles. Accessible equipment. The parks have equipment that you just have to call and ask. So they have track chairs and pool chairs, hand cycles. So as long as they know, they can transfer that equipment to the park that you might be camping at or visiting for the day. They have pedal boats, and all of their parks have accessible kayak launches, and we will meet people, especially families. The whole goal is not that you would do adaptive recreation with a therapist. That's not what you and I do. What we do is we learn and we become familiar, and then we go out into our community parks with our own family and friends. And that's the point of our collaboration, is that you will have some recreational therapists, some trained people to help you, to guide you, to give you the equipment so you can feel comfortable. And then you go out to the parks and you just let us know if you need the outriggers on the kayaks or if you need some special seat. We'll have it there for you. So, wow, I was really quick. Good. So in closing, I just want to encourage everyone to get out and to encourage people to get out into the parks. There are so many adaptive and inclusive activities that we provide. I know I get requests every day. I provide programming based on requests. So if I have someone that says, hey, I'd really like adaptive cooking, but I live in a place where I cannot get there, then we'll do a virtual one. We have yoga that we have done a hybrid, because we have people in the thumb who don't want to drive 45 minutes to get to a program. But then we have some people in our Troy location that might want to come, so we'll do a hybrid class. I also love to have anyone who has a special skill that they would love to share with the world. I would love to help collaborate so we can do it together. We've done some poetry programs where I had a client I was working with who loved poetry, so I said, let's do it together. So we did some poetry classes, and then we set up a poetry reading at a local coffee shop. So I love to do adaptive and accessible and independent programs for people. If you have any questions.
Board? Yes, Dr. Hunt.
So, a lot of our citizens need assistance with, and especially the physical activities, but sometimes also with crafts and art and things like that. So what kind of manpower support do they need? Do they have to bring someone with them, or?
No, we provide that.
Okay.
So we have staff that will come and assist, and we also have volunteers. So especially like for the kayaking, if people come and the parents or family or caregiver want to kayak with them, then we will allow them to do that. But we have trained volunteers, 2 per kayaker, that are within 10 feet of each person. And the craft and art programs, I have staff that come and help with that depending on what we need. And we provide all the equipment, and everything is free. We don't charge for any of the programs at this point.
Thank you.
My pleasure.
Yeah, John.
Thanks for coming. I heard you present, and I was sitting next to Adam at that. This is really good, and I give you guys a lot of credit. You've come out of the pandemic and figure out ways to make this work for so many in so many different things. I mean, I think that was one of the things coming into the Abilities Day. The concern was, is there enough happening with enough variety, or is it all just kind of baked into a few programs? So my compliments to everything that you've done and your willingness to continue to expand, because I think that says a lot to let people expand rather than feeling they're locked into the same program every Tuesday at 5 o'clock period. So,
right.
Thanks for your work.
Thank you.
Dennis?
So how do you get the word out to the community about the different programming that you're providing? How do you do that?
So I have a personal email that I send out to a group of people, so I'll probably be sending to Suzanne now. but we also have social media. We have a newsletter that goes out to about 13,000 people. And it's not an annoying newsletter. It is a newsletter where you're just getting like twice a month, once with all the activities and once it might be an update on disability-related issues. We are always looking for new partners, so I'm interested in, if anyone is interested in having me speak at other organizations, volunteers, and also I like your wellness center, so we might be looking at doing some partnerships there.
So we've talked here since the beginning of the year that, pre-COVID, there were a lot of different organizations, whether they were faith-based, connected with churches or schools or whomever, that did a lot of different activities, everything from dances to athletic type activities, and that all went away. So now we're trying to rebuild that. It wasn't even a loose network. It was just people doing good. So I'm glad you're continuing to lead in that, and I just urge that however you can get the word out, especially I have a son in a group home setting, and anytime they get to go do something different is always positive for the house. It's positive. So with that network that we have, of the group homes that we support, if you're getting the word out to them too, that's important.
And I would love that. So my heart is with the DD community. I worked as a recreational therapist for 17 years at MORC.
Okay.
So we had like a $300,000 grant when I was there. So I got to do, therapy of horseback riding, and I got to hire a chef. So then I learned how to do adaptive cooking and pottery. And so I'm able to now take a lot of that where I am now. And we are getting a lot of group homes, but I'm sending things to the people I know at MORC, but I would love to get the word out to more people because I know we could expand this and have some volunteers out at other community locations to just continue and grow this program.
Right.
I just started at DNEM about 16 months ago.
And I would just ask you to consider, in Oakland County I know of, and I'm sure in the other counties, there's a lot of, sports activity groups of adults, such as just, I've seen stories about people taking, a group of fishermen would take out folks on pontoons to fish, archery, all kinds of things. I think if you ask, you'll find a lot of partners. It's just identifying, and some can't do it for a variety of reasons, and the first question people have is insurance and all that. But be that as it may, I think if you reach out to those groups, there'll be a lot of people who will want to get involved, and you'll find a way to do it.
Yeah, and I would love that because we have equipment. We have some funds for equipment. I can't run. I'm the only rec therapist, so I cannot run all of these programs personally for 7 counties, but the key is collaboration. So I can help someone to feel like the golf. I'm not going to run golf every Saturday, but I'm going to run a couple clinics, one in Oakland County, one in Macomb County, and we're going to train golf pros and provide them with the equipment that they need so that they can do what they love, golf, so I can do what I love, which is planning and implementing and creating new programs. So.
Going to go on your website, get some ideas. Maybe I'll make some suggestions.
Yeah, I would love that.
You know what you're doing. We just need to find more partners for you to.
And I'm open. My email, I know Suzanne has it. I don't know if it's on the agenda. I have some of my business cards I will leave, but I'm open. Please email me if you have any ideas, any partnerships.
Well, I'll give you one idea.
Yeah.
In my opinion, and I'm a former mayor, every municipal golf course would love to have some kind of partnership with you and take a time and a date, 2-hour block, whatever it is, how many athletes there are that want to participate. A lot of cities, people want to do things, they just don't know where to go, so I'll just throw that out as one idea.
Thank you.
But thank you.
Yeah, my pleasure.
Jonathan?
Yes.
I have one more comment. Yeah, my son actually does skiing.
I saw him. I helped him.
Michigan Adaptive Sports and also with OATS, horseback riding, great programs, but they need a lot of support. In terms of like last couple of years, they haven't had enough volunteers. FAR is another one. I don't know if you collaborate with them.
I have not.
Okay.
I know
that
of
will
them
be-
well.
They have a large program, and my son has been going there for almost 20 years.
I remember your son at Moore.
Thank you.
I did horseback riding with him.
No, yes, thank you.
Long time.
I remember that. Thank you. And also Birmingham Public Courses.
Okay.
I can give you the name of the person to contact.
Absolutely.
She will be a great resource, and she has a child with special needs or some
Yeah.
in our community, so.
Okay.
That's
And
what
we're
we-
starting a partnership with the orthopedic medicine program, the medical school, the orthopedic medical school at OU William Beaumont.
Yeah.
So they are doing some fundraising for us, and they're hopefully going to collaborate to provide some more volunteers for our program. So maybe we can funnel them. That would be great for horseback riding, I think.
I actually spoke to people at Michigan Orthopedic Rehab, and they were interested. That was like pre-COVID, and I don't know. They may still be interested because they have a lot of interns from the program at OU and also Wayne State. So, yeah.
Thank you for that.
But I will reach out to you by email on your website.
That would be
Thank you.
great, thank you. And there's a calendar of all events on our website, so all of the programs are there with links on how to register. Any other questions?
Okay.
Not a question, just a comment that you're perfect for what you do. You have that energy, and it's coming across in your presentation. I enjoyed it very much.
Thank you.
And then the other thing, have you heard of Leadership Oakland?
No.
That would be a good place to solicit volunteers.
Okay.
And they may, because the classes take on a project every year to raise money for and do different things. So they have a website.
Okay, I will look it up, Leadership Oakland. Thank you.
You're welcome.
All right. You bet. Were you raising? No. Oh, okay. It's hard to tell sometimes with Dennis right there. 2 foot taller than the rest of us.
Blocking everybody's view.
But Carrie, thank you for bringing your message and coming tonight and sharing with us.
My
Suzanne.
pleasure.
And Suzanne, thanks for bringing her in here. So, all right. Again, thank you. Okay, so next on the agenda is our board committees. So right now we have Dr. Giles, who's new, who's not assigned to a business or policy committee. We also have the Citizens Advisory Committee, CAC, and we're looking for a representative for. So I think we want to tackle the, yes, Malkaya. That's what I want to do, is tackle that first. Is there someone who would like to be our liaison to the CAC? Anyone else? I guess you volunteered yourself. Those are morning meetings, if I remember correctly. Okay. So welcome back to that. Okay. So the next is Dr. Giles, and she's not here tonight. I know she'd have a choice of business or policy. I know normally we would tackle that topic in October. We go through officers and things like that. But since we do have an opening, I figured, and it's on the calendar, and I thought she was going to be here.
And the updated bylaws note that it's supposed to be placed as soon as the vacancy.
Yes.
So.
But I thought I would ask if there's anyone that was interested in shuffling from policy to business or business to policy. Then we wait till October for the usual for that, and Dr. Giles will get. Well, we have Dr. Giles, and we also have Navy Dyer's opening too. So we really have 2 spots.
So, correct. That's why there's a position open on each.
On both?
Yeah.
Okay. So, all right. Well, I guess we'll table that till she comes to the next meeting. All right? Let's move on to board chair reports. Okay. All right, I'll start with the board report. My usual, this one is for April 2023. So we met back a month ago, March 23rd. Wow. The committee did not have a quorum, so while we couldn't vote and take action, we did provide feedback for the agendas that you've seen so far for the month of April, which we're now halfway through. The DE, and not only did that happen, but also the DEI training, the diversity and inclusion training that we have that was scheduled for the 23rd of March is now scheduled for next week, Thursday, April 27th. So just a reminder, we do have a study session next week, not 2 days from now, but in 2 weeks. I'm sorry, not 2 days, but in a week and 2 days. As well, our CEO's, Dana's three-year contract expires this summer. We're now going through the process of contracting with legal counsel to help do with that renegotiation. Hopefully that will go smoothly without any issue. Her contract's up in August. We want to put that in place before that happens, before we have a void. Also on March 23rd, we had an Executive Director Performance Review Committee meeting. And again, for that one, we didn't have a quorum. So our quorum is made up of 5 board members, the chair, the board chair, the board vice chair, along with policy and finance, and a person who's receiving services, bless you, and our board secretary. Sorry, didn't want to forget that. So we did not have a quorum at that meeting, but we were meeting to review the CEO evaluation survey. I'll talk about it. We actually met again tonight prior to this meeting, so we've given the approval for the evaluation survey, the 360 that's going to go out. It's going to go out tomorrow. It's going to be a few weeks before it comes back, and then we're going to meet like the first week in June to discuss the results of that survey once it's done. So we are moving ahead with that, and that's for the performance review for our CEO, Dana, is next to me. CMHA, so our association, they have their spring conference coming up on Monday, June 5th through the 7th, up in Traverse City. Board members, please, if you are interested, let Sheila know you are interested in attending. It's probably the nicest time to be in Traverse City. It's not too warm, it's not too cold, and there may not be snow on the ground, like sometimes there has been in October. And then on the other topic, as always, please remember to contribute to the Political Action Committee. Typically the stipend, typically the amount we contribute is roughly 1 meeting's stipend. And the website is cmham.org, public-policy, /CMH-PAC. And since I'm prone to repeating myself, the board study session. Our April board study session is scheduled for next week, Thursday the 27th at 6 p.m. The topic is DEI training. Tricia Z and Bernard Hooper will be doing the presenting. And prior to this meeting, we'll have an executive committee meeting. That's at 5 o'clock. All right. Any questions? All right. See you a week from Thursday night then. Next up is the Policy Management Committee's report. Yvette? You weren't here, but I think Yvette was there.
Correct.
Yes. Yes. So So do you have any report to report out from the Policy Management Committee from the last COW meeting?
The two items that came before the committee, were approved to go to the full board. I don't have my agenda in front of me. One dealt with Mental Health Month, and actually it's on today's agenda. Thank you. There was an update from the corporate compliance group, and the mental health awareness proclamation was approved by the policy committee to come before the full board. Those were the two items.
Okay, thank you. And those were approved by the committee?
Yes.
Okay, thank you. All right, now for the Board Treasurer and Finance Committee.
Yes, at our recent Committee of the Whole meeting, we did discuss at length the Budget Amendment number 2, which we recommended. So, as we discussed at that meeting, we had some numbers moving in the wrong direction. Not that that wasn't anticipated, but with the end of the pandemic and the end of some revenue flows and expenses continuing to be incurred, there's a little bit of what I described as turbulence. As our CFO described, there's, she can describe this in more detail for those who want to ask questions when we come up to this item. But the point is, mitigation measures have been in place. They haven't totally taken effect yet because of timing. We have some outstanding issues, such as with the state and reimbursement rates and things of that nature. So we're going to have to kind of gut through this a little bit for the time being. We don't have, since we're halfway through the fiscal year, we don't have a lot of time to do anything dramatic. We do have funds in our fund balance or savings account that could cover this. We'd prefer not to. We just, every month we have to monitor the situation and see how these mitigation factors are working. So it's not a simple answer that there's one thing. There's several things going on all at once. But we had an idea this kind of situation was going to develop, and we're not reacting to it but planning. So, but after a lengthy discussion and a lot of questions, the committee did approve the budget amendment to be forwarded to the board for consideration and approval.
Okay, thank you.
I did want to, John, I just wanted to supplement your discussion about the timeline for the CEO contract. So the board knows the plan in the timeline is to come to the June COW meeting with a recommendation and then a vote on that recommendation at the board meeting in June. So for those, I know it's an important issue for everybody. So in terms of planning, and we'll keep you apprised. I mean, I can't see anything that would derail that timeline. But if we can't have a meeting or something comes up, we may have to delay it. But the plan is to try and do this in June at our the COW and board meeting in June. Okay.
So you're talking here. So that last topic was related to the CEO bonus.
Right.
Just if anyone was trying to follow on with the financials. Okay.
Yeah.
Okay. Thank you. So with that, I know Policy Committee had approved or recommended approval by the board for the Mental Health Awareness Proclamation. Is there anyone from that committee that would like to make a motion to approve the proclamation?
I'll make that motion.
Thank you, Sarah. Is there a second?
I'll second.
Thank you, Malkaya. Is there any discussion? Yes.
Can we read the proclamation again? I think it's just always nice to do it before we vote on it, in case somebody's viewing or watches the replay of the meeting, even though we did go through it at the COW meeting.
Yep. Suzanne's probably digging it up as we speak. Usually it's me that suggests that we read it at the board meeting, and they say, really? So, Suzanne, we're going to give you the opportunity to read it so I don't butcher the proclamation.
I'm happy to read it for you. Okay. So it's Mental Health Awareness Month, May 2023, whereas mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also affects how we handle stress, relate to others, and make choices. And whereas mental health is important for our individual well-being and vitality, as well as that of our families, communities, and businesses. And whereas surroundings can impact how and when an individual's needs are met, which affects mental health, and having stable, healthy home conditions establish the foundation for obtaining and maintaining good health. And whereas May 1st through May 31st, 2023 is recognized as Mental Health Awareness Month, with a focus on supportive environments and the impact our physical surroundings have on individuals and population mental health. And whereas Oakland Community Health Network continues to inspire champions to address the social determinants of health impacting our community. And whereas mental health recovery not only benefits individuals with mental health disorders by focusing on their abilities to live, work, learn, and fully participate and contribute to our society, but also enriches the cultures of our community life. And whereas improved systems of care for vulnerable populations, enhanced and expanded access to non-emergent and crisis services, advanced integrated physical and behavioral health care, collaborative, this was a change that was from last time, healthcare with collaborative provider relations, and strengthened workforce are identified priorities for OCHN. And whereas Oakland Community Health Network and its service provider agencies are committed to inspiring hope, empowering people, and strengthening communities. Now, therefore, be it resolved that Oakland Community Health Network hereby recognizes May 2023 as Mental Health Awareness Month. OCHN calls upon our citizens, government agencies, public and private institutions, businesses, and schools to recommit our state to increasing awareness and understanding of mental illness and the need for appropriate and accessible services for all people with mental illnesses to promote recovery and a higher quality of life.
Thank you.
You're welcome.
Are there any other questions or comments regarding the proclamation or the motion? Hearing none, can we do a roll call vote on this, Sheila?
Mr. Young? Mr. Furman?
Yes.
Mr. Cowan?
Yes.
Mr. Torres?
Yes.
Dr. Hans? Ms. Newman? Yes. Ms. Root? Ms. May? Ms. Woodruff?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Thank you. Okay, next on the agenda is the BA2, the board amendment, the budget amendment for our financials for this fiscal year. As reported earlier by Finance Committee, they voted to approve the BA2, the budget amendment. Is there a motion by the treasurer of the Finance Committee?
Yes, so moved.
Thank you. Is there a second?
Second.
Thank you. So it's been moved by Dennis, seconded by John. Is there any discussion on the, budget amendment? Hearing none, when you are ready, we'll do a roll call to approve it,
Ms.
Sorry.
Woodruff?
to approve the motion.
Ms. May? Ms. Root? Ms. Newman? Dr. Hans? Mr. Torres?
Yes.
Mr. Cowan?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Landsman?
Yes,
Motion carries.
thank you. Okay, does so the next item on the agenda, we voted, as a CEO evaluation committee earlier. Do we need to bring this up during this business of the board meeting?
Um,
I'm looking to Gerard.
It was, I added it because it was my understanding that you guys were seeking full board approval of the timeline, but does that make sense? Mr. Hooper? Oh, it makes sense. So, if you guys want to seek the full board approval of the timeline of the evaluation.
I don't think we need to do that. The committee is supposed to handle the base timeline, the survey. We voted to release it.
We can do that.
Right. So we probably don't need to vote on the evaluation timeline at this point.
Okay.
So what will happen is a survey is going to go out starting tomorrow. It's going to go out to the public for a 360. We'll be looking for responses back. So please check your emails, folks. There'll be an opportunity to provide feedback on the performance of our CEO, on Dana, and her efforts in the team. Those results will be back, if I have this correct, let's see, by 5/8, by 5/3, May 3rd. And then from there, it will come back to our committee for evaluation and review the results. And then based on that, our committee will make a recommendation, to the board at the COW meeting on 6/12. We'll report out at that point. Okay? So that's the timeline for our CEO. And then again, as Dennis said earlier, the goal here is that if we are ready at that point, we have an evaluation with our proposal for the full board. We'll make that report out, and then at June 20th board meeting, if it has been forwarded, we'll make the recommendation of a motion. We'll look for the board for feedback for approval, and then at that point we will have approval for her bonus to meet on July effective for her anniversary. All right? So that's the timeline. But I don't think at this point we need to have a CEO evaluation timeline because our committee that does that actually voted to approve it. So we'll move on. Any questions? Okay. Next item is consent agenda. We have 2 items, or 4, depending on how you want to look at it. The board meeting minutes from March 23rd, and then meeting minutes for recipient rights, Committee of the Whole, and Citizens Advisory Committee from the month of March. So I'm looking for a board member to make a motion to approve the consent agenda.
So moved.
Thank you, John. Thank you, Melchias, for second. It's in a consent agenda, so there's no discussion. All we need is a roll call vote.
Mr. Torres? Yes. Mr. Cowan?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Dr. Hans? Ms. Newman?
Yes.
Ms. Root? Ms. May?
Yes.
Ms. Woodruff?
Yes.
Mr. Landsman? Motion
Yes.
carries.
Thank you. Okay, next item on the agenda is other business. Do we have any topics for it? I don't think so. So we're on to committee reports. Bashaya, for the recipient rights, please.
The Recipients' Rights Advisory Committee met on April 6th at 4 p.m. The first item was welcome of the new member, as we approved Amit Agarwal at last month's meeting for appointment to the committee. He was welcomed. Then there was an election of the officers of the committee. Liz Janovich was elected as president and Amit Agarwal as vice chair and vice chair. Presentation on needs assessment was made by Suzanne Weiner, and that discussion went very well. There were a lot of suggestions and ideas that were explored. In the continuing series of training of the committee, there was items are reviewed every month, and this month was the makeup of the advisory committee and the responsibilities of the members. And this was done by Vicky Suder. Site visit report was given, and that is 29% complete as of March 2023. The next meeting is scheduled for May 4th at 4 p.m. Thank you.
Thank you for your committee report. And I don't think we have a report for CAC, but gosh, you're back on that committee again, aren't you?
Yes, I am, and the next meeting is tomorrow morning at 9:30.
Okay, so we're looking forward to hearing what's going on. Appreciate it. Yes.
I just want to let the board know that that is an in-person meeting tomorrow being held here. So if anybody wants to attend, or you can attend virtually, but it is going to be held in person.
Okay. And the RAC ones are also in person, first Thursdays of the month, correct? Ah. Back to the building. Cool. All right. At this point in our agenda, it's a second opportunity for public comment. Folks are allotted 5 minutes to share their perspectives, as long as they're related to OCHN business, et cetera. Is there anyone remotely? No? Is there anyone in the building that would like to make public comment? All right, thank you. We welcome public comment, so see you at the next board meeting. Next up is our director's report. Dana, you have the floor.
Thank you. Good evening again. I first wanted to start with some really good news. We had a NAMI Awards ceremony on Saturday, and actually we have 5 nominees, and Christine, please help me with the names if I leave anybody out. One of our nurses, Janet, what's her name? Susan. And what's the last name? Stevenson. Our own Dr. Pozios was one of the nominees for medical director. We had our law enforcement partner, one of the officers from the CIT program who actually is responsible for the pet or the dogs that we sponsor, the therapy dogs. And then our own Diane Sandel Sloan, I pronounced her name wrong, I apologize, won the award for direct care worker. So she was there, and it was so exciting to see her go up and accept her award. And she actually had a special escort take her up, a previous contestant on the Bachelorette show. So she was quite pleased and happy about that acknowledgement. And then also our rabbi from our Oversight Policy Board was also a nominee as well. So it was an exciting night. We had hoped that we won more, but I think it was just amazing that we had 5 people who are nominated and recognized for the work and contributions that they put towards serving people in our community. The other things I want to update you on, and just to align them with our strategic plans and goals and objectives, Kim, our Chief Clinical Officer, actually attended a value-based care conference in New Orleans a couple of weeks ago. We actually got stuck there, but that's okay. We had a lot of good information, and what we're doing internally is really looking at our service models and looking at how we better align them with key performance indicators from the state. So right now, they're in place, and of course, our core providers are operating off those service models, but we really want to look at them and really streamline them to make them understandable and to make them in a way that looks at incentivizing for outcomes that are over and beyond the minimum requirement. So just really pushing for outcomes and not just to provide a certain service or a certain evidence-based practice, but really what are the outcomes. Because you can provide a service, but if the individual continues to need hospitalization or more intensive services, we really want to look at outcomes to their care that's being provided. The other thing that we are looking at is looking at our departments and how they operate and really are efficient in terms of what they do. We started with our access team, and we're looking at data collection and analytics that really will help us make improvements to how we deliver and expand access services. So we have some data collection that's being done, and we're able to really look at performance, but also what happens to individuals when they contact or reach out to our access team. So that's really critical. And it also ties to the work we're doing with crisis, because we know that the access team actually operates in the Resource and Crisis Center where Common Ground, as well as our Children's Youth and Family Care Connection Center is. And I'm happy to say that we actually have children being served in that unit. The census has been beyond 4. In most cases, we have 4 children and families being served. And so we're ready to look at some of the outcomes that we're having for families that are being serviced there. The other thing, we have some exciting visitors and tours of the Youth and Family Care Connection, as well as some legislative folks from the state that are being invited by Common Ground to do tours. And so we appreciate Common Ground's extension of including us in those tours, so we're able to highlight the services and supports that we have. So one of our visitors was the Director Hertel, who was very, very pleased about the service that is not readily available across the state. Actually, I believe we're the first to have a crisis-like stabilization unit for kids. So I'm sure more to come on that, and really looking at how do we build that so we can expand it and have it readily available for other families. It's an 8-bed unit. We know the need is greater, but we've seen some positive outcomes so far. So that was great to be reinforced for the work that we're doing to fill in some of those gaps where we have needed services. The other thing is meeting again with Capital Services to really touch base with our legislators again. I know for a fact that that privatization bill will be reintroduced. I talked directly with one of the senators that is going to push that bill and really extended the opportunity to really work with them to see how we can find balance and make partnerships as opposed to really just eliminating the the public system. The other thing I'll say is we are also looking at our integrated care initiatives, and we know we have behavioral health homes, SUD health homes, opiate health homes. The other big thing right now is the certified community behavioral health clinics. And for us, it is CNS and also Easter Seals, and really working out how we work better together. So we know we've been invited to a couple of meetings with Bob Sheehan to address some of the concerns that each of the entities have, as well as finalizing some of the data elements that are critical to determine if this is something that we can continue on and support. And I know there's big push for the state, throughout the state, to push this model of care or programming. And it does have some value to the community for people who previously did not have access to mental health services because they didn't meet the traditional criteria that is required. Quality of care, I think it relates back to number one, where I talked about looking at our processes and finding inefficiencies, but also finding ways that the things that we do very well, we can expand on and build on. And then finally, staff retention and recruitment. So we know that last month we talked about our award of being a great places to work. Now we're looking at the data and the outcomes to that. And we do have some work to do because we're hearing from employees about some of their concerns, how they feel equity and fairness is being handled. So we are committed to being transparent and making sure that we address the concerns of staff, even to the point where making sure we're responding to concerns and questions that come up in a timely manner. So really looking at our policies and procedures to make sure that we're addressing the needs of people who work here. So they'll want to work here and will have those good environment and safe environment to be a part of this team. So I was trying to see what else. Oh, one of the other things is we actually had a meeting with the new Deputy County Exec, Madiha Tariq. I think I said it properly. And she actually came over here to see our building, to see what we're doing. It was a very good meeting. She's very excited about partnering and also looking at the health department's programs and also aligning those programs with our programs as well. So for every program they have related to perhaps infant mortality, we have infant mental health. So looking at how we partner in those things. But the other pieces, and it goes to the questioning about the redetermination of Medicaid, we do have a plan. We are working with the Oakland County Health Department as well to partner and fill in some areas where we may not have enough opportunity for people to do the redetermination. But the other piece of it is also, and I know Anya has addressed this as well, sending our providers the list of people who are due to be or need to reapply or redetermination process. They need to be engaged in that because they're up for that process before they're at risk for losing their benefits. So there are a lot of good things going on. We have some few issues that we're addressing, and that's my report.
Thank you. Lots going on.
Mm-hmm.
Any questions for our executive director? Yes, John.
Comment and a question. So on the redetermination, it's working. I was nagging Christine a lot about getting stuff out, but so we got the first heads up from our MORC coordinator well in advance. There's not even an official date, but it's starting to sink in. I think most of the big providers are as worried as we are about just the mystery and the lack of the ability to kind of reach into that. Second, when you mentioned the county, my second favorite topic, what's anything new on transportation that you can report?
Not yet. Anything, Adam, that we can provide an update on?
No, not at the top of mind, but we've been doing a lot of work on it, both internal and external, just aligning the different plans, but let me get some better information for you.
Other questions? All right. Next on the agenda is board comments. Sheila, if you want to take us through a roll call list process.
Ms. Woodruff?
I appreciated the comments from the CEO tonight and enjoyed the presentation from our first, the person from the DEM. It sounds exciting in terms of all of the activities that they have for people, making them more accessible.
Ms. May?
No comment.
Ms. Root? Ms. Newman?
No comment.
Dr. Hans?
Yeah, what has been on my mind is the firearm violence. We had a spate of events in the last couple of weeks, which really is almost scary. I know friends and families now who are worried about their children going to school even. So that's something. I did some reading on it, and we noticed that it's in the media and in lay public also, it's always associated with mental illness. Unfortunately, most of the perpetrators don't have a history of mental illness. However, some of the conclusion, and this is some raw data, that the psychopathology of these conditions is actually, all of the analysis is retrospective, so therefore not in the scientific community considered accurate. But one thing is clear, that these ideation of disorders of internalization and externalization, frank psychosis, start in adolescence. So we have one more thing on our hands to address. And I think it's important that we collaborate with the education system and see and be aware of what they are doing in terms of at least screening or foreseeing any events, because sometimes these can be very subtle. A child who is not able to socialize in a classroom or early childhood program, perhaps those things are critical to be addressed, and I think we have to start looking into that also, because I think we can make an impact, at least in our children's life, if not the adults. Thank you.
Mr. Torres? Mr. Cowan?
No comment.
Mr. Furman?
No additional comment?
Mr. Young? Mr. Landsman?
I want to take a minute and thank the board for being here tonight. Dana, you and your team, the staff out there in the field, those that aren't able to listen in because they put in a long day already. For the folks that did a lot of the preparation of materials over this past month. So I really appreciate it. We are going through a lot of change here. There's going to be a lot more change. Just with movement out of the emergency order, that's going to have quite an impact on what we do, how we do it, the revenue coming in, as well as how do we serve those folks that we've been serving for the last, well, since well before I was on the board, but certainly all the additional folks that have come on board during the pandemic that may be stepping off because of a lack of coverage. I know it's, we're talking about it, we're worried about it. I can also tell you that through some of my circles with the payers, they also are a little concerned, more than a little concerned, what to do with the folks that they're losing and what its impact is on the community. Even though we may think they're cold and heartless, they're not, and they too are worried about what that impact will be on the community. So, in general. So with that, I just want to say it's spring. You might not believe it from the snow, but please enjoy the upcoming, look positive and enjoy the upcoming days of warmth and sunshine. That's it. With that, I'll bring our meeting to a close. Good night.
Thank you.